My name is Scott Swartzwelder. I'm a clinical psychologist and a neurobiologist. I've done a lot of work in my research lab on adolescent brain development and the relationship of adolescent brain function to pathology and the distinctive effects that drugs of certain types have on the adolescent brain. ADHD is a brain-based disorder that essentially emerges when certain circuits in different regions of the brain have difficulty communicating effectively with one another and organizing an individual's behavior. ADHD is diagnosed in a multifaceted way. It's very important to sit and talk with the individual, get a sense of how they are in conversation, how they process information, how fluid they are in their communication, can they sit still, etc. It's also important to get input from people who know that individual. So parents, teachers, partners, friends, and get good information about how others perceive that person's behavior. Finally, we can use neuropsychological screening to look at their cognitive strengths and weaknesses and determine whether or not those are disrupted. If they are, then we'll have a much better sense of how to proceed in terms of treatment. Children are most likely to be referred for ADHD assessment when they're in school, when they show an inability to concentrate, an inability to pay attention, inability to suppress moving around, right? So usually it's somebody in their environment notices one of those features of behavior and recommend for an assessment to occur. Testing can provide a wide range of information about a patient. In the case of cognitive testing, for example, it gives you a sense of what the person's cognitive strengths and weaknesses are. So that can be helpful in educational planning. It can be helpful in determining whether or not there might be a concentration or attention deficit, or just how that person works in terms of their ability to process new information. Cognitive testing never results in a definitive diagnosis on its own. It's always part of a broader assessment that would include a clinical interview, medical history, educational history, social history. There are a lot of factors that go into diagnosis, but cognitive testing results can be highly informative and can often make the difference between a confident diagnosis and one in which a clinician might not feel very confident. Well, the things to expect from a testing consult is that it will depend on what questions are being asked, how long the assessment might take. It could be anywhere from 30 minutes to 3 or 4 hours, depending upon the question that's being asked. It's always done in a calm testing room with a professional test administrator, whether that's a technician or a clinician trained to give those tests. And the interval between when the testing is conducted and when the results are available, again, will depend somewhat on the extent of the assessment, but our goal is to have those results available within a couple of days. Parents should be asking for testing for ADHD anytime they become concerned about it. Parents know their children better than anyone else does. They're going to notice the differences in behavior. So anytime they notice changes in a child's behavior that are inconsistent with the way they've been in the past, I think that's when you raise the flag and go ask for some help and an assessment. I think anytime a parent has questions that they can't answer themselves or that their primary care provider cannot easily answer, they should consider the possibility of cognitive testing. Well, a patient may need to be tested even though they might have already been diagnosed with ADHD if we want to figure out a little bit more about how that ADHD may be affecting the way they process information or what their particular strengths or weaknesses are from a cognitive standpoint. Attention and concentration deficits don't just do one thing to a person's ability to adapt and learn and behave. It's a multifaceted illness, and so we need a multifaceted approach to understanding its impact.